Awesome. Welcome everybody to this training. In tonight's training, I'll talk to you about how to sinus lift and place implants with clarity and safety to double, if you follow the teachings, the implant opportunity in your practice. If you follow this training, you will learn how to find simple and predictable sinus lifts. You'll learn how to perform a sinus lift with safety. I'm going to go over the different steps. I'm going to share with you how to identify and avoid the risky ones, which we, not going to do. And I'll share with you how to double your implant opportunity by adding sinus lifts to your menu. Because here's the reality. At least 90% of all implant cases require some type of augmentation in the sinus. And it's a very simple procedure. It requires training. It requires knowledge. And it is now proven for so many decades that it's possible to create bone where there was none before and be able to place implants and make sure that you have stable dentition and having your patients function with a fixed dentition without dentures. Now, in order to grow bone, you need to grow. Grow requires change. I don't take sinus lifting lightly, but again, here's the reality. The math is very simple. If you don't have enough bone in the sinus or in the posterior maxilla, you can now place implants where there was no bone before. The math is doing more implants, implant restorations, more bone grafts. And this is the implant opportunity. It basically unlocks a tremendous potential in your practice. How to do this? I'm going to share with you the step-by-step in just a minute. I just want to make sure that you're aware that this procedure alone, when it comes to implants, can allow you to place many more implants and serve your patients better. And a lot of these typical cases come from failing bridges that have an abutment that has a vertical root fracture. There's a molar that was replaced with a 3-unit bridge, probably because there was not enough bone to begin with. And when it comes to the area after it heals, patients often say, and I see this all the time, I can't get implants. I have a sinus problems. Well, your patients don't have sinus problems. They have sinus proximity. There's a tremendous potential here that you can leverage to serve your patients and grow your practice. I already unlocked that potential in my own practice here in Beverly Hills. I'm surgically trained, and I've been teaching this for many, many years, not just specialists, surgeons, and periodontists, but thousands of dentists, mostly general dentists, that are doing this at a very, very high level. The key is really case selection. I don't treat every case. I'm very selective. I'm very safe in what I do. There is high liability if you don't follow the rules. But just looking at this image alone, you can see the potential of how many more implants can be placed if you have the right case selection, if you have the right systems. So if you learn the systems, and systems are teachable, you can follow the same things. Because many patients and actually many doctors look at the sinus as if it's a black hole or an abyss of some sort. Most dentists tackle the sinus in one of two ways, either with fear and confusion and then taking too many risks, or avoiding it altogether, never doing sinus lifts, never leveraging that potential, never increasing their implant opportunity, because dentists, and we all do, have fears and concerns. For example,